Hello and welcome to Health Digest, a program that brings to you news, analysis and developments and everything that concerns your well-being. And today we will be exploring the health sector in 2024, and also we focus on the HPV, which is fast spreading across countries. Ogom Ezedimbo. And 2024 has come and gone, carrying with it the perennial problems in Nigeria's health sector. Infrastructure inadequacies and personnel crises have continued to stretch public health institutions at both federal and state levels, exposing the huge funding gaps and justifying why health professionals are fleeing the country non-stop. On the program, we explore how rising cost of healthcare is pushing many to the brink and the systemic reforms requiring urgent attention in 2025 and beyond. The rising cost of accessing healthcare in Nigeria has reached alarming levels, pushing millions of citizens into poverty. A 2023 report by the National Bureau of Statistics reveals that over 70% of Nigerians rely on out-of-pocket payments for medical services, making healthcare increasingly unaffordable, especially for low-income earners. A recent survey among Nigerians shows an 80% increase in consultation fees over the last 5 years. Medications and lab tests are also becoming out of reach for many.
The payments, especially if you must do the whole medical routine, it goes into some thousands.
Then everything probably would be like 40-something thousand. You know, a little over 40,000 to do an entire check, but now it's almost double and over that amount.
In the year under review, the pharmaceutical sector has been hit hard. Nigeria imports about 70% of its drugs, and foreign exchange instability has caused prices to skyrocket. Essential medications like insulin, antibiotics and antihypertensives now cost 30 to 50% more than 2 years ago.
It's affecting a lot of our patients. Medicine is life. It's not like any other commodity that you can just forget about it. It saves lives. And when they come and they cannot afford because of the high cost of medications, it's something that is touching us also, that are professional, that are also giving them the care.
Patients like Bernard and Gloria, who have been battling diabetes and cancer for years, decry the rising cost of care.
The cost is the big elephant in the room. So I started buying this at 456,000. That was 4 months ago. But from last month when I went to buy it, it's now 586,000. And I hear it has increased again. I don't know how much.
So
now.
Just one policy from the president. Because the moment, just like he's been giving executive order, he should give an executive order that diabetes test free, and it will put some money back into our pocket. If you cannot make the drugs free, why not just subsidize?
Adding to the burden, Nigeria's health institutions face inefficiencies, resource shortages, and an ongoing brain drain.
Now, both the young, the old, the not too old, they are living. And they are living to where they will practice medicine.
To address these issues, the Nigerian government, in the year under review, launched the National Health Sector Renewal Initiative. The plan focuses on expanding primary healthcare services, particularly in underserved rural areas. The initiative also aims to incorporate advanced health technologies to streamline service delivery and improve outcomes. Additionally, the National Policy on Health Workforce Migration, approved in August, seeks to curb the brain drain by improving working conditions and offering incentives for healthcare workers.
Where we have problem is in execution. And the challenge is not inabilities. It is not because people don't know what to do. It is not because we don't have the personnel to do it. But then our greatest problem is character. Poor characters. Our greatest problem is corruption.
They insist that tackling Nigeria's healthcare crisis requires a multi-pronged approach, which includes increased funding, universal health insurance, local drug production, retention of health workers, and improved accountability in health institutions. Most importantly, the stress prevention.
This has to do with individual responsibilities. Health education and promotion are some of the key functions of primary health care. Many of the health conditions that account for the high burden of disease we have in Nigeria has to do with our environment.
So how is the Nigerian government responding to some of these issues? The federal budget of 2025 has a proposal of 2.48 trillion naira for health, higher than the 1.5 trillion naira provided in 2024, but it still falls far below the 15% benchmark needed to significantly address the depth of the problem, as agreed to at the Abuja Declaration. Without funding, primary health care, equipment, personnel, and welfare issues are poorly addressed. And this is why brain drain has continued unabated, meaning Nigeria will soon run out of qualified health professionals. A 2023 WHO report showed that Nigeria is now left with just about 24,000 licensed doctors for its over 218 million people. The challenges in Nigeria's health sector are profound, but the solutions are clear. With adequate funding, genuine reforms, and political will, the nation can begin to bridge the gap and ensure quality healthcare for all its citizens. If there was some ray of hope in the year under review, it was the launch of the malaria vaccine in 2 pilot states, Bayelsa and Kebbi. With many unable to afford basic over-the-counter anti-malaria drugs, the vaccine could just be the saving grace to prevent the nearly 200,000 malaria deaths recorded in Nigeria in 2023 alone, according to World Malaria Report.
Very good.
If you are just joining us, the program is Health Digest. 5 years ago, the world was hit by a deadly virus known as COVID-19. Its emergence exposed weaknesses in health systems across the globe, including Nigeria. COVID-19 devastated economies, and even today, countries are still working to recover from its impact. And now, another virus, also originating from China, is spreading rapidly. It is called HMPV. What is this virus about and where did it originate? Let's bring you a quick report on everything you need to know about this virus.
Human metapneumovirus is a virus that will lead to a mild upper respiratory tract infection, particularly indistinguishable from flu for most people. First identified in the Netherlands in 2001, the virus spreads through direct contact between people or when someone touches surfaces contaminated with it. Symptoms for most people include cough, fever, and nasal congestion. The very young, including children under 2, are most vulnerable to the virus, along with those with weakened immune systems, including the elderly and those with advanced cancer. If infected, a small but significant proportion among the immunocompromised will develop more severe disease where the lungs are affected with wheezing, breathlessness, and symptoms of croup. Like many respiratory infections, HMPV is most active during late winter and spring. Some experts say this is because the viruses survive better in the cold and they pass more easily from one person to another as people stay indoors more often. As of recent reports, human metapneumovirus has been detected in several countries, experiencing a surge in respiratory infections, particularly during colder months. The affected countries include China, United Kingdom, France, Germany, United States, Canada, and Australia.
And here in Nigeria, the Nigerian Center for Disease Control and Prevention has assessed the risk of HMPV and in collaboration with the Federal Ministry of Health and partners has classified the risk to Nigeria as moderate. In a public advisory signed by its Director General, Jide Idris, on Monday, the NCDC stated that it is closely monitoring the situation and has implemented proactive measures to ensure public health safety. The NCDC clarified that the World Health Organization has not declared HMPV a public health emergency of international concern. As part of its preparedness, the NCDC has expanded surveillance system and testing for HMPV has been integrated into the existing National Integrated Specimen Referral Network, which also tests for COVID-19. Laboratories and states with international airports have been equipped to enhance diagnostic capacity nationwide. To mitigate the risk of HMPV transmission through international travel, stringent protocols have been enforced at points of entry, and this includes readiness assessment and deployment of infection prevention and control materials. Healthcare facilities across the country have been directed to adopt enhanced IPC measures, and such as proper hand hygiene, respiratory etiquette, and environmental cleaning. Hospitals are also required to establish isolation rooms for prompt management of suspected cases. To shed more light on HMPV, we spoke with Dr. Ifeanyi Kashmel, an infectious disease expert and president of the Association of Medical Lab Scientists of Nigeria.
Why are we having so many reports on respiratory viruses now?
Of course, before COVID, we had always had the flu seasons in Europe and then some parts of the developed climate like the Americas. So flu, it's common. And the viruses that account or that are the etiologic agent for these flus are all related, whether it is the current one that we have an outbreak of a sort in China, which is the human metapneumonic virus, or the respiratory syncytial virus, or SARS-CoV, which later, of course, we had a variant that became the COVID that was responsible for the 2020 COVID-19 pandemic. So most of the time, these viruses become manifest with their ability to cause disease following some weather changes or climatic condition. For instance, the human metapneumonic virus is said to be more virulent in parts of the world that are further away from the equator. So the countries that are closer to equator, yes, may have the impact or HMPV cause diseases all year round, but those that are further away because of the shift in climatic conditions, when they are the peak, like in most parts of Europe now, some parts of Russia is around minus 60 degrees. So if you take that in UK, it's snowing heavily that they've even closed schools for some days now in the United Kingdom. And so at such extremes of weather, respiratory viruses become fulminant. They cause diseases, and their impact are usually fulminant, and that accounts for the HMPV outbreak we have now in China, which is said to have spread to some other parts of the world, like France, like Germany, and even parts of the United Kingdom. When you have outbreak of this nature, you look at your data, and then you monitor the outbreak, the development of the outbreak, how is it spreading, and then you characterize the outbreak before you can make a full categorical statement about that particular outbreak. For now, the World Health Organization is yet to declare as international public health emergency on the human metapneumotic virus, and that's because they are looking at its spread. But the good thing is that most parts of the world, including Nigeria, are beginning to shore up their preparedness to respond to this outbreak, because one disease in any part of the world is disease in every part of the world. So we know that we have a very recent history of the COVID-19, how it all started out in China, the conspiracy, the pretense, the hiding it and not giving a full reportage, of course, put the whole world on the crucifix, which God and then, of course, public health experts and governments of the world were able to navigate, and we had normalcy restored, and then the disease brought under complete containment and control. So it's gladdening to note that even the Nigerian Center for Disease Control is upbeat in terms of preparedness. Of course, just within the last 48 hours, the Nigerian influenza sentinel survey system evaluated their data and gave a categorization that Nigeria can be said to be at moderate risk, not high risk. But then the reason why it's of concern is that if we are moderate, it means we have exited low-risk categorization. So it means that citizens must become more cautious. Why? We have a dry, windy, dusty weather here. We do not have snow. But this weather we have, the climatic condition now, also supports the spread of respiratory diseases. Everywhere you go in the north and in the southern part of the country, you see people wheezing, people coughing with one kind of a respiratory disposition or the other. And so, meaning that the weather we have now accentuates respiratory diseases. And if that is the case, I think that also accounts for the categorization of Nigeria as a moderate risk with respect to HMPV. So it's good that also they are beginning to make arrangements to strengthen laboratories that are located at ports of entry. There are also arrangements in place to begin to ready isolation centers should we be needing that again. The good thing is that if this outbreak, nobody desires it comes, God forbid, we will say, if it becomes upscaled, we will ride a lot on the lessons learned from COVID, on the infrastructural and the human resource improvement which COVID had bequeathed us. But again, there's a caution or an advisory. The advisories will go to the Honorable Coordinating Minister of Health. It's time also we begin to train frontline health workers on how to manage this, particularly clinical services personnel. And that means medical laboratory scientists, physicians, and nurses. We would need to train them on how to do dictation, because we know that a chain is as strong as its weakest link, and our weakest link in this part of the world is ability to dictate. Ability to dictate is a function of your testing capacity, your ability to test at the right time and to fully characterize a etiologic agent. We do not have very robust systems that support this at all points. We are also not oblivious of the fact that, yes, ports of entry, we will be thinking of Nnamdi Azikiwe Airport, we'll be thinking of Murtala Mohammed Airport, Aminu Kano Airport. No, people leave and enter the country in droves from the perimeter borders. And most of these places are not fully manned. And most of these places are not contiguous to facilities that have capacity for testing. So it's important that as we strengthen testing in designated NCDC or internationally funded testing centers and laboratories, we also begin to show up the capacity of laboratories that are within our secondary and tertiary health institutions, federal medical centers, and teaching hospitals in Nigeria.
And talking about preparedness, we still have the issue of health check at the port of entries and at borders and both the international airports. Some passengers who came in as of yesterday were not even given the health card, or were not even given the health form to fill. Isn't that showing some lack of competence?
From Ebola to COVID, we have always noticed that our port health has a lot missing. These lapses noticed rest squarely on the inability of the port health authorities to put in place processes and systems, almost fault-proof processes and systems, in documenting people as they enter. It is important we document people, and as costly as we can do some form of respiratory testing as people enter. So it's important we do not trivialize this. HMPV is not common in Nigeria. Its origin is not to Nigeria. Yes, it is said to have been around for more than 6 decades, but then lately he had become, maybe variants had emerged and is becoming very, very fulminant and virulent. So we need to be on the watch. That is thumbs down for the Ports Authority. If people can fly, do a haul from China, and you know China is the hub for our people. There's hardly any merchant, any businessman, including Nigerian government, that do not go to China as if they are going to their bedroom. So if that is the case, and there's an outbreak of this nature, which is attracting global attention, we must put in place mechanisms in our country to make sure we curb it, to make sure it doesn't come here. And if it does come, we are in a position to be able to contain. This is how Stella Dedivo paid the supreme price. Somebody escaped the port health. Ditto for COVID. People were going in and coming in without COVID test during the COVID time. It was a bazaar of sorts for people with corrupt tendencies to just collect money and don't do any form of testing. Some were even faking the test. So there is a lot wrong with our systems, and we need to get that right.
No, as individuals, what should we do? Because we need to take responsibility for our health.
Respiratory hygiene. If you know everything you were asked to do during COVID, it is now time to bring them back. Hand washing, the use of face masks, the habits when you are sneezing, the habits you must adopt when you cough. So all that must come back. You have to avoid very dusty and windy environments. You must properly dress yourself and kit yourself, keeping yourself away from the cold and the harsh weather.
And that was Ifeanyi Cashwell providing valuable insight into HMPV and its implications. And this is a time for us all to take responsibility for our health. As with the COVID-19 era, we are reminded of the importance of wearing face masks, washing our hands frequently, and using alcohol-based hand sanitizers. Stay safe, maintain social distancing, and prioritize your well-being. And thank you for joining us on Health Digest. Until next week, stay informed and stay healthy. I'm Ogom Izedimbo.